Welcome once again to Ask Dr. Tommy O, and I'm proud to be the co-host of this program. And Dr. Tommy O, as a co-host and also now a frequent visitor of Church Alive, we had a great Easter service. You want to talk a little bit about that?
Yes. No, we had Easter Sunday. We had a wonderful time. We had a beautiful Mass, and this Mass was multicultural. We had a sermon by an African minister. We had song and dance, a praise dance in the African language. We also had within the Spanish language, song and dance as well, and as well as the Korean. We also had in English as well as the Korean language. So
that was something wonderful to have the sermons in Korean and then in Spanish and then in African, all really saying the same thing about the resurrection of Jesus Christ.
That's correct.
That was a great time.
We had a good time.
Yeah. Well, folk, I hope you'll come, and we're looking forward to having you visit us. And certainly, if you're looking for a church, then Church Alive might be that church for you. But we will welcome you. Anytime you come, we will welcome you with the love of the Lord. Okay, we have a very, very important topic to deal with that everyone has been reading about, and it's steroids, okay? And the topic is the truth about steroids. Now we've seen ball players and famous people who we love are now crumbling before us. They're famous crumbling before us because of the use of steroids. And so we felt, Dr. Tommy O and I, that it was important that we educate you as to what is steroids. And so we're going to turn right to Dr. Tommy O, and we're going to address that issue about steroids. Okay. What are steroids?
Well, yeah, we need to address this because it's pretty significant. And when we go through the figures and the statistics, you're going to see how significant steroids are in our community. Well, what are anabolic steroids? Anabolic steroids are man-made synthetic chemicals that mimic testosterone.
Now, what is testosterone?
Okay. Well, that's a good question. What is testosterone? Testosterone is a naturally occurring hormone that is found in our bodies, both men and women. Women have testosterone, but they're in very low levels that the effects of testosterone are not noticed like they are in men.
Okay, now we're talking about the functions of it.
Well, we'll start off first with the function of testosterone, then I'll bring in the function of the anabolic steroids. Again, testosterone. Testosterone is a natural occurring hormone that is found in all our bodies. In men, it is responsible for the male characteristics or male sexual characteristics, and then we'll go into and define that. Male sexual characteristics are the thickening of the vocal cords, which when we go through puberty, as youngsters or boys, we have high-pitched voices. When we go through puberty, our voice starts to deepen, and that's because of the testosterone levels start to increase. We also start to have hair on our face. Our hair becomes coarser. Later on in life, we end up losing our hair. It also is responsible for the strength and development of bone, the deposition of calcium in the bone to make them stronger, as well as the increased size in muscle and strength, as well as endurance. It also increases the organs in our body, the systems, the organ systems in our body. An example would be the bone marrow, where it's able to produce more red blood cells. Now, getting to the function. The function of testosterone is to, in muscle tissue, we'll just say exclusively muscle tissue, to increase protein synthesis, which increases the size and strength of muscles. Now, let's say, what is the function of anabolic steroids? Anabolic steroids, again, mimic testosterone. So when you take anabolic steroids, we have an increased level of testosterone, and again, increased protein synthesis, which results into increased muscle size and strength.
Okay, now the question we want to know, who takes steroids?
Who takes steroids? Well, according to the National Drug Administration and drug associations, they have all these studies. They say that there is no limit, there is no exempt group who take steroids.
You mean anybody can take steroids?
Anyone. And according to these studies, it suggests that anywhere from 8th graders all the way up to college students, from professionals to non-professionals, non-athletes to athletes, the entire gamut of the population can take steroids.
All right, now we want to deal with, we hear so much about steroids in men, but do women take steroids?
Yes. Women right now are the most increasing or the increased group, largest group of taking steroids in America today.
Mm-hmm. Now, testosterone is responsible for male sexual characteristics. Define what they're talking about.
Okay, we're going to address this again. Okay, male sexual characteristics are characteristics what make men men. Again, it helps us through, you know, in puberty, we increase in size, the strength, muscle growth, the maturity in muscle. It increases the thickness of the vocal cords so that our voice drops, so we get a deeper voice. It also increases the bone marrow production of red blood cells, so we're able to increase greater oxygen, where we increase the size of the muscles, increases protein synthesis, so the muscles themselves grow, they get stronger. The organ systems increase in size. That's one of the functions of them.
Okay, why would a woman take steroids?
Well, again, according to the National Drug Association, these studies, well, there's a number of reasons for the taking of women taking steroids, but some of these situation would be to be part of the economical situation where they want to be able to perform at the level of professionals because of endorsements. There's financial association that are involved with it. Also, they want to feel empowerment through strength and appearance.
Okay, now we're going to just go back to the men and athletes, because we're seeing a lot of people on television, and we've seen them before and we see them after. And there's a big difference in their body mass, those who have been taking steroids. And maybe sometimes we don't, if we're looking to see if a person is on steroids, then these signs that you mentioned are, you know, sort of telltale.
Right.
Am I correct?
That's correct.
Right.
Well, I'll give you an example, not being specific, but let's take some of the professional players. We'll leave it at that. You'll see them in their rookie year, they're very thin, and 2 or 3 years later, they're about 20, 30 pounds heavier of solid muscle, and now they're breaking records. That is a telltale sign that they're taking, you know, probably taking anabolic steroids. You just don't gain that kind of muscle, size, density, and strength naturally. There are going to be individuals out there, a small percentage, that do make those gains naturally, but for the rest of them, you just don't see it.
Okay, now I know for steroids to be there in the very beginning, there had to be a good reason for it, okay?
Right.
So you want, because a lot of people think, well, maybe this is like a drug that was made, you know, to, you know, or as a dangerous thing,
Right,
okay? But it wasn't.
Right. Well, let's just address, well, why were steroids produced in the first place. In the 1930s, that's when steroids were introduced to the world, and they were designed to address medical conditions such as anemia, hypogonadism, as well as a few other diseases, and most recently the muscle wasting in HIV patients.
So in other words, the good side of taking steroids was for medical purposes.
That's correct.
Okay, and medical purposes where people were really in danger of losing their lives or losing limbs, and it's fatal situations.
Right,
and so that was a good reason why they developed it. But who takes steroids?
Again, who takes steroids? According to the most recent studies, there is no exemption in the population that takes steroids. It could be middle and high school